Guys, we got this, okay? Okay, hi guys. Thank you so much for your patience. As I was saying, my name is Veronica Sogby. I am very passionate about sustainability. I have been working in sustainability since very early in my career, basically since I first started my training. And I have always had a passion for avoiding waste, which because I come from a third world country and I come from Venezuela, I have always been very passionate about that. So I'll tell you a little bit about my history in a little bit. So next slide. So I have nothing to disclose. Next. So I wanted to give you a little bit of a background. I've been working on sustainability in several institutions. I trained at the University of Pennsylvania. I have gone to several hospitals there in Philadelphia. I also work at Stanford as a sustainability lead. Not only as a pediatric anesthesiologist, but I also work with the sustainability department. And I have learned a lot of things. So that's what I wanted to do this introduction. I wanted to talk to you about a little bit about my journey and how did I started. I wanted to show you what existing surgical supplies recovery programs there exist out there, and some challenges that I have encountered during these times, the lessons that I have learned, and hopefully now that I'm in Jackson Memorial, my goal is to apply all of these lessons that I learned and use it as a future directions at the University of Miami. Next. So as I was saying, and I was also going to say a few words about Liz. I'm now in the Jackson Memorial Hospital. I've been very fortunate to land here and meet Liz in my journey. I feel that it's very important that when you work with people that are like-minded, and you get so much done, because if you have people that support your initiatives, it's very easy, like to move forward if you're people that are passionate. And my goal with you guys was to maybe inspire you a little bit to make these programs in your own institutions, because a lot of people want to help, but sometimes they don't know why. They don't know how. So I think it's very important to see how past experiences have gone, and see how you can adapt that to your own reality and your own institution. There's always something that we can do, and this is a short presentation, but it's mainly I want to make sure that I inspire you and that you have time to make questions and I can show a little bit of my experience. Next one. The next one. That was just showing our hospital. Since I started working with Lisa with the climate committee, we have done a collaborative work with Practicing Green Health. Practice Green Health, for the people that don't know, is a leading membership organization that helps and collaborate with hospitals to create and deliver environmental solutions. Lisa Joseph is the climate committee chair, and how important is it when you have somebody in the leadership really thriving and trying to make sure the sustainability initiatives are applied, hospital-wide. I want to say that I was very surprised when I first started here and I started seeing all the many initiatives that they have been already implemented. This is not only about in waste. When you talk to your leadership, you can show that this initiative also save money. Our hospitals have been able to save millions of dollars in the last few years just by creating sustainability initiatives. So I feel that this is a very important point when you talk people that only care about money and you care about the environment, but it's important to meet everybody, in the middle. And this is a very good selling point. So Jackson has won multiple awards in their initiative in water, chemical, and sustainability procurement. And it's my goal to see if we can bring this surgical supplies recovery program to do more benefit to our hospital and to the community. Next one. So when you see this bonus metrics in the hospital, the things that we are going to, when you do the bonus metrics about when Green Health, Practice Green Health shows to you, you can see how much money we have saved. And it's not only it's systemic-wide sustainability initiatives, that are in all the realms, right? That they are in water, in electricity, in peri-op environments. But that doesn't mean that little by little, in your own initiative, in your own floors, in patient units and departments, you cannot save money. This is a compound savings that you do. So every little initiative helps in the long run. Can we do the next one? So I wanted to start, I said that as an introduction, and tell you a little bit about myself, how did I start in these surgical supplies recovery programs. So I come from Venezuela, and a picture that you see here is a reality out there in the rural areas. So we see patients in the floor, we see patients, two patients in the same stretcher, really things that shouldn't happen nowadays happens there. I have traveled other places in the world where this happened, but telling you from my own experience, when I first arrived to United States, and I first started training at the University of Pennsylvania, that is a multi-million-dollar hospital, I was like very surprised. Can you do the next one? Because you can compare the juxtaposition here. What I was used to being able to have to treat my patients, I had to buy my own aesthetic strip, I have to buy my own tape, my own gauzes. I will buy everything with my own money so I could take care of my patients. And then coming here, when I see all of the med students doing rounds, the next one, and they can, next, and you can see next, you can see how these med students are like running with these pink buckets full of supplies, the supplies that I used to buy myself, and they're running around and they're leaving it everywhere. That's one of the first time that I had really a cultural shock, and I realized how different. Obviously, we practice medicine, and that I come from a place where we really care about the supplies that we are using, and maybe sometimes we give for granted how much materials we have here. For us to throw out a tape or throw out a study strip is nothing. There's places where they only have 10 IVs a month. So if you don't get the IV in the first try, it's important, right? Now you have one IV left to use for your patients. And I think if COVID taught us something, is that we can have that mentality. I feel like COVID pandemic really helped us understand that we need to savor our supplies, and we really need to be mindful of everything that we use and how do we use it. And now that we know better, we should do better. Can we do the next one? So I had the opportunity during my fellowship. I did a patient safety fellowship at the University of Miami, and I had the opportunity to work with the peri-op director. We had like a full, it was a full conference room with like 20 chairs, huge tables, and they were just going to wrap everything up and destroy it and go to the trash. And I stopped the meeting, and they said, all of this is going to be trash on Friday. We're going to have the new chairs and the new conference room, moving up next Friday. And I was like, what do you mean? How do you mean that you're going to trash all of these? And they said, yeah, I mean, obviously in the United States, it's easier to trash than to be able, to repurpose the things. And I said, well, I want to find them at home. And they said, okay, you have like 2 days to find them at home. I was able to call the director of the Hispanic clinic, and in that meeting, I talked to him, and he said, "Yes, we will receive them." And this is a picture of the director of the ED clinic, and he came to pick up these chairs himself, and I helped him around with other people. And can you do the next one? And I want you guys to see this because this is very close to my heart, and this is one of the times that I have seen how sometimes people want to help, but they can't. All of those tables and chairs, okay, everything that you see there was going to be trash, okay? And that became the lobby of the Hispanic clinic. I mean, I find every time that I give this presentation and I see this, I really get very nostalgic because I feel that it's impressive how something that is trash for somebody else, it can be so useful for another. And I think this is the exact concept of what sustainability is. And can you do the next one? And you can see all of those chairs, guys, all of them were going to be trash. Next one. So that's how I really started applying the surgical supplies recovery program. After having that opportunity, and the director of peri-op allowed me to do that for the first time, he started allowing me to repurpose things in the operating rooms. So we implemented a project that was with supplies that were clean, non-sterile, and these supplies were taken from the OR, and even though they were non-sterile, we were able to send them abroad. And it's no surprise that medical waste accounts for 33% of the total healthcare expenses in the United States. We all know that we waste a lot of resources, especially in the inpatient units and in the operating room. U.S. healthcare system produce approximately 6 million tons of waste annually, and this is very old statistics. I haven't been able to find like new ones just related about all the waste. Now they're more specific, but it's a tons and tons of waste that shouldn't be there, that ends up in the landfill. At least 200 million worth of prepared materials are discarded unused in the OR each year. And those are the things that I targeted the most. For example, when there is a transplant and they open everything in the OR and then the transplant gets canceled, all of that gets trashed. All of it gets trashed. And those things that were not contaminated, even though they're not sterile anymore, they can be donated and they can be re-sterilized in the receptor country. So as you see this, there was a study in neurosurgery that showed that hospitals discard significant amounts of unused supplies. And they maybe even worth $1,000 supplies per procedure that they waste. This was a study that they did in a neurosurgery cases, and they realized that they were wasting tons of supplies that were really unused. Some major American hospitals discard more than 15 million per year in operating room supplies, and they produce tons of waste, as I already explained. Can you do the next? So to decrease this gap, like between how much we waste and how much need there is in other countries, I decided to start researching about the surgical supplies recovery program. So I was placed in connection with places that have a lot of experience. So SHARE, supporting hospitals abroad with resources equipment, is a program that is in Johns Hopkins, and they have years of experience doing this. They collect supplies that they're not using anymore or they were going to trash, and they send it abroad. And Remedy is in Yale. And there's a nurse in Colorado that plays supplies called Partners for World Health. She also does a similar type of program. And as you see, it's very important that either in a big scale like Johns Hopkins and Yale, or in a smaller case like Partners for World Health or Mind Surgical Supplies recovery programs, you can always do your part. And I'm pretty sure that this is obviously better than doing nothing. Some people think that if you don't do big, you don't move the needle. And in my perspective, just the compound movement in the right direction is what's really important. Next one. So I wanted to show you here the donations. I collected over $200,000 in supplies, and I was able to send these to Venezuela, Colombia, Peru, and Liberia in Africa. So these are all the boxes of supplies that are being donated. Obviously, there was a lot of cargos. One of the problems that we had to stop during COVID, but we've been able to implement this, in several institutions. Next one. So one of the things that I learned being at the University of Pennsylvania, Temple University, and St. Christopher Children's Hospital, everything in Philadelphia, was that you needed to create a longevity. These programs cannot depend on you. And those are the challenges that I encountered, right? That if everything depends on me, then when I leave, then who's going to, continue the program? If COVID happens, like it happened in the past, and pandemic happens, and we have to stop, and then somebody leave, who's going to reinitiate the program? So thinking about longevity was very, very important, and that's the most important thing that I learned during these years. So when I arrived to Stanford Children's Hospital, then through those learnings, I decided to create a program, a volunteer program that will be self-sufficient, and that this volunteer program will continue to do the job no matter who was there, always leading the program. So we created a program, Caroline, that is one of my partners. It's called A-Wish, which means addressing world inequity via sustainable healthcare. And A-Wish is now a self-sufficient program that we collect supplies from the operating rooms, and we do other sustainability initiatives with a well set up of volunteers that are always running. Like, we always have volunteers add up to the list. So it's like a machine that is always moving. And that was the most important thing that I learned in the past that I really wanted to bring here and implement here. Can you do the next? So these programs can be used to decrease a lot of waste, and not only the supplies that you can donate, but there's a lot of potentials in recycling that it can be helped by, these volunteers. These are images from Stanford healthcare system. They generate 17 tons of waste every 24 hours. This is the equivalent to 11 residential garbage trucks serving 11,000 households per day. They are a huge system, but can you imagine that this is happening every day? For me, seeing these statistics is outrageous. We are in the process of publishing this data. These recycling and all these bags are fulfilled with what we call the blue wraps. And so when you are donating supplies, you can also collect blue wraps. That is what is saving the instruments and making them sterile. It's like the wrap that has the instruments sterile. And then you can also use these volunteer programs for other projects that are related to supplies recovery. In this case, the supplies that we will be recovering will go for donation. Can you do the next one? So then A-Wish aims to reduce waste and distribute resources in global health equity. We have the website if you guys want to check it out. And then you can see the videos, you can see the amount of projects that we do. And even though that I moved to Miami 1.5 years ago, we continue to partner, and hopefully we can try to replicate this here. And it will be amazing if you guys could replicate something similar in your own programs. As I said, my main goal with these type of talks is to inspire you to be a champion in your own institution. And we're always here for you if you need help, navigating, the logistics and the politics of this. Can you do the next? So what challenges I have encountered? Well, first of all, to be able to set up these programs, the main thing that you need is leadership support. The first thing that you need to do is go to the leadership, party up, inpatient units, climate committee like Liz. And then when you work together, that's when really things happen, because these are the people that have the authority to approve your initiatives, and also to connect you. Because the most important thing for me when I first arrived to Miami is now to know who am I going to talk to, right? Because when you spend 5 years in another hospital, you know everyone. You know who to talk, who is the supply manager, who is the green people. But when you arrive to a new place, the first thing it would be to do a need assessment and also study your stakeholders. Then you're going to need manpower. For doing this type of processes, you need to have that volunteer program will be my first advice. And then second, you're going to need the nurses, the stakeholders, mainly the nurses in the operating room or in the floors. They're the front runners of all of these projects. And then you need to have their buy-in. And you're going to have an educational nurse that allows you to train them so they can screen all the supplies that are collected. Remember, once these projects start, especially in the operating room, you're going to get a lot of supplies. So it's very important to be able to screen those supplies and to have a place to do that. That's why storage is a problem. For example, Share, that is in Johns Hopkins, I told you about it, they have a huge basement, and I was told that basically they ship twice a year. The University of Pennsylvania had no storage at all. So that was mainly our problem. And I'm seeing the same problem at the University of Pennsylvania at Jackson. I don't think we have a lot of space to collect those supplies. So every institution is going to have their own problems and their own challenges. But if you learn from what other institutions have done, and that's the first thing that I did, I called Share, I called Yale, and I called all the other institutions so I could learn what their problems were while they were instituting their own programs. And I soon realized that we all have different ones. So for me, storage and distribution was the main problem. I had a lot of people collaborating, I had a lot of help and a lot of supplies, but to take this from the storage to distribution was a big deal. Now we're working, distribution means that how we're going to send this from our hospital to the country that is going to receive this. Or the laboratories, many of the things that get donated inside the same hospital for laboratory, for research, etc. So those are some things that you can think about. Not necessarily you have to donate to another country. Some things, if they stay local, is less, it's less carbon and like things that you're going to do for the environment. And then a donation receptor, my goal was to have different champions in every country that will receive the supplies. And we're still working on that. Right now we work with several countries, but our goal was to have people that will receive the donations and could do something called a shopping list. When you have the supplies that you have available, you have donation countries that is asking for certain supplies. So then you can do what it says there, responsible donations. Because that's another thing that I learned during these supplies programs, that when I went to Liberia for one of my medical missions, we had a room of supplies. And then when I was helping check everything out, I realized that they were donating cardiac sutures that can only be used in cardiac surgeries, where they are dying because they don't have antibiotics, right? It makes no sense. There was not a correlation between the things that they needed and the things that were donated. They were donating very specialized things. They don't even have a cardiology in the country. So it was a discrepancy that it was very obvious. And then one of my goals and one of the things that I learned is that responsible donations is also very, very important. So it occurred to me that if these countries could tell me what they needed, I could do kind of like a shopping list in the supplies that I had. So you can match those requests with the donations. Can you do the next one? So for the things that I learned about the longevity, as I said, is mainly to have leadership support, to have rollover programs where the volunteer staff is being trained by the volunteer department. So you do need to talk to your leadership of the volunteer department to create your own program. And hopefully, AWISH has been able to maintain for a few years already, and it's going strong. So Lisa and I are looking on a way of doing this at the University of Miami. So we are in our beginning steps to do that. Can we do the next? And for our future directions, we hope to use this volunteer program for the surgical supplies recovery program. Not only in the operating rooms, hopefully we can extend this to the inpatient floors. Liz has great ideas about recovering supplies from the rooms of the patients, being sterilized and being cleaned with different methods. And if we can do that, my second phase that I never got to do was to work on instrument processing. When I first worked as a rural physician, I never had supplies to suture my patients. So one of the things that we realized is that all of those instruments that you guys are seeing the kits, for example, suture removal kits, we can use also these in the emergency room. Many like central line kits, all of them has instruments that are called Pakistani instruments. They're single-use instruments. But in true life, if you talk to people that are experts on their instrument processing, they have 400 lives. And we're wasting these instruments only at one use. So my goal was to use all of these scissors that were used, all of these crowns and all of these instruments for wound suturing and suture removal, and collect them and then clean them. They don't have to be sterile. They can just be washed out and then send them abroad. and they're going to be very useful in many places where we suture with our own hands and X-ray needles. So that was very important for me as my phase two. So hopefully I will get to do that in the future. And well, we have a lot of projects also to use these volunteer programs to defer the blue wrap, that is what I told you about. That is a special textile that is created with a plastic that covers the instruments to keep them sterile. And if we can take those blue wraps, get them outside the landfill, and repurpose that for different things. They use it as a textile. They can use it to do furniture. There's a lot of things that they can use with that. So repurposing that will allow us to decrease waste. Can you do the next? So this is what I was showing you. You can see the blue wrap in there. And this is what I was telling you, that this, so far, the project that I have in Stanford that we're replicating here at Jackson has diverted 11,000 pounds of waste from the landfill. And it's basically doing 500 pounds every month. So that's very significant. And I think at the end of the day, this compound effect is going to really make a difference. The next one. And our greenanesthesia.org website already launched. This is a website that my partner and I at Stanford was doing. It's already launched a few weeks ago. What is still obviously very raw, but our goal was to put everything green there, and especially being able to, provide vendors that are sustainable, people that are into green anesthesia, resources, so people can go there and just find whatever they need. And if you guys have any advices of what to put in this website, or do you have any requests of things that you would like to know, how to find it, vendors or anything like that, we can always help you. You can send us a message and we can always help you. All your feedback will be greatly appreciated. Next. And this is all. I put here my information. And if you guys have any questions about how to set up these programs, I'm in the works of creating a manual on how to do this assessment and how to create this based on my experience. And hopefully I can publish that someday so I can put it on the website so it can be like free for anyone who wants to try to do this in their own institution. Thank you so much.
Thank you, Dr. Sogwe. That was an excellent, excellent presentation. It was very informative. One of the things we are also doing is working along with Blueprints for Pangea. It's part of the University of Michigan program that started with the donations, if anybody's interested in that. So if you have medical students, nursing students, these are great projects. They love to get on board for this. So we are working with medical students here at UM, collecting some of those donations. And you're right about finding spaces. So these students, they're very motivated. So right now, they have taken all these products from our hospital and they're storing it in some little room at the university here at medical school. So I'm very excited to be part of this team and seeing all the progress we have made with collecting and reprocessing items. I see John has a question.
Yes, hi. Great presentation. My name is John Lonis. I'm a PA. I'm based at Duke Health in Durham, North Carolina. And I started a similar program over 20 years ago at Duke, modeled after the Yale Remedy program. I encountered exactly the same issues that you did. Very similar story. What I wanted to ask is the two biggest pushbacks that I always get is around quote expired materials, things that are past date, which we all know are totally fine, and many countries are happy to accept them, or nonprofits. So I wondered how you get around that. And the other issue is always around infection prevention team. They're always nervous about, making sure that we are not violating any guidelines that they establish, which I understand, but it takes a lot of work. We had to spend a year just trying to get around those two issues in particular. So I'm just curious how you have addressed those.
So for the first one, I talked to the risk management and the lawyers at the University of Pennsylvania, and they created a release form for me. So, like whenever I donate, like it creates like a free liability, for like the institution that is donating. So they did kind of like a page. I mean, I'm happy to share that too, because, like we can adapt that to any institution. And then you can pass it through, like your own lawyers, like just to be safe, you said like, hey, this is a release form, like you want to update anything here. And I
Yes,
think that
we
really
did
helped.
that with our program. We have a disclaimer that the hospital legal department had to approve. So that's
Is that
key.
okay for you to share? Like I always like to share like with other, if you have it yours, I would love to see it if you can send it to me. Um,
Yeah.
that will be very helpful, because I like to collect like different things that, I mean, you have a lot of experience, you could be doing this stuff too. But it's very nice to hear, because every institution has their own problems, right? So the second one with infection control is that you have to do a lot of teaching when you have all these nurses or the volunteers screening the supplies, right? Nothing can be, touched. It has to be clean, non-sterile, and it has to be sent in a nice way. Like one of the things that I've been working on is also about sterility in the country, to see, even though that we have no liability, I wanted to make sure that I can give them instructions on how these products should be re-sterilized. So I was actually working on that when I was in my hope to writing my manual, which I think you should collaborate with me, since you have a lot of experience.
Well, I would add too that that's a good point, that some countries are very strict about what they will accept, and others not as much.
I know
And so
it's not.
you have to have a good connection at the other end.
And also, one thing that I discovered is that you have all of these companies. You have to be careful who you're working with, because there's a lot of companies that accept supplies and you think they're free, right? That they're sending this to Africa and they have all loving in his heart. And then you realize that they pack all of these containers with supplies that they send from United States. No, they don't check anything. This is like a lottery container. And then they sell these containers to the African hospitals. And so when I learned that, I was like in shock. And then I realized you really did need to do your research to see how your products and the things that you are, sending are arriving there. One of the important things is that if you talk to the leadership and the supply managers, especially, Penn did something amazing for me. Like they wanted to clean up a storage, and they call me and say, I want you to clean this storage. They're not even expired. They just need more space. So they're so wasteful that they just wanted to get rid of everything. And I went with a container and I placed everything in the container and we sent it to Liberia. And it was a full container of things that were not expired, that were new, and they were very useful. They were gloves, gowns, things that were very, very useful. So, like I feel like finding those opportunities where it doesn't necessarily have to be expired is good. Penn also used to do something like a new surgeon arrived. He doesn't like the supplies that he has anymore. He wants a new brand. They will discard everything else. And then they will buy the brand that the surgeon likes. So all of those supplies that were not expired got sent to Venezuela. And they helped so many people because they were automatic, staplers, things that are very expensive. And we were able to do surgery in a lot of patients with that. They were sterile, they were clean, we had no that issue. So those are the little things, that I have learned here and there.
And how do you manage the shipping? We don't get any funding for our program to ship. We rely on the recipients to transport it.
Yeah, well, the first shipments I pay myself, but I pay myself because if I was sending $30,000 in supplies on sutures, staplers and all of that, I was paying $500. I didn't care, right? But my goal have always been to be a nonprofit that can receive, like money, so I don't have to spend that. I also find out that there's certain, I don't know if they do this yet because now COVID happened, but before COVID, I was in the works of talking to Amazon, Apparently, they have like a program where they send for free for nonprofits on June and December. I don't know if they still do that. But one of the ways that the Liberian Medical Mission work on this distribution is that he appealed to the heart to Liberian owners. So he, the chairman, investigated all owners of distribution companies, then went to talk to them, and he negotiated 1 container a year for free. So those are things that we can do. And now I have that in Philadelphia. I don't have that in California. In California, we use a company that takes all the supplies and they distribute them. They're a nonprofit. So they're in charge of all the distribution for the shopping list. And in Miami, we're in the works of trying to connect with nonprofits that can receive our supplies, especially because we're in a unique position in Miami because we are in front of all Latin America. Right from here, I could really send it to Venezuela for free. Cheap. The shipment should be less for Colombia, Peru, and all Latin America and the Caribbean.
Thanks.
Well, I'm very happy, Jones, that I got to know you. So please leave me your information so we can connect, because I'm pretty sure that we can, learn from each other experiences.
And Dr. Sorgwe, we put your email address on the chat.
Okay,
I just shared mine with you as well.
Okay, wonderful. Thank you so much, guys.
Anybody, any other questions?
Let me see if I see his.
I'm looking in the chat. I don't see any more, but
I don't see his, but you can send me an email.
But it's amazing the amount of waste we have, and Dr. Sorgwe and I are very much involved with capturing these waste from these brand new trays. It's got for example, they would say, "Oh, the patient needs a chest tube," and we would take a chest tube into the room, and then the physician says, "Oh no, the X-ray has been cleared. So now what do we do with this chest tube?" So because it's already in the patient's room, so with infection control, we cannot throw that brand new, not even opened, into the, now we have to put that in the trash and it goes in the landfill. It's just a very compounding effects with, now it has to be incinerated because it has to go through certain levels of disposal. So it's costing the hospital a lot of money, and it's just environmentally unsustainable to do something like this. And like Dr. Sorgwe mentioned, there are so many countries that are in need of this, and not, and why waste something so new? So we are looking into an aspect called the clean sweep, whereby they'll use UV sterilization to sterilize, they'll pick up these instruments or equipments or whatever from the patient's room, sterilize them, and sell it back to the hospital at a lower cost. So if that chest tube tray, insertion tray costs $1,000, they will sterilize it and sell it back to us for $400. And it's saving, this is something that we're really pushing forward. I feel this is the best way to go right now, while we're looking into other areas of donation, or picking up things for that we can donate, because there's a lot of things that we already have. I mean, I have a lot of things stored in my office right now that needs to be donated. So.
And optimization of the kits. For example, if you are in your company, you want to optimize all the kits so you don't have waste. That takes time because that takes negotiation with the vendors. But that's when we wanted to put that website at thegreenanesthesia.org, is because we want to make sure that you are able to work with vendors that can do that for you, that are amenable to do that and save also money to the hospital. We were able to optimize one of our nerve block kits, so we could not waste the povidone and the gauzes and all of that. And we went from like $48 a kit to like $40, and those $8 in compound save a lot of money. So like it depends on how much users you have, but as I said, little by little it makes a difference. Also, we're working on the circuits, the anesthesia circuits that in other countries they use it for a shift. We changed our circuits for anesthesia in every patient. And I trained here, so I didn't know that. But we are basically one of the only countries that changed our plastic anesthesia circuit, that is all plastic and is big, for every patient. In other places, they just do it every 12 hours or every 24 hours. Imagine that. So, like there's a lot of potential for things that we can do.
I see Justin joined us from Burkina Faso. Wow, Faso from West Africa. That's
Oh,
excellent.
wonderful.
Send us your email so we can keep in touch.
Yes, I'm going to send you guys, I'm going to write here my email in case that it didn't appear. And you guys feel free if you need help on navigating this, I'm always happy to help navigate meta.miami.edu. Okay, so this is my email. So feel free to email me and we'll be able to orient you in whatever capacity we can. Thank you so much. I'm glad that we didn't go over time with all my software issues.
Carol, do you have any last minute announcements?
I do not. I don't know if Kylie, do you have? Oh, Kylie must have had a hop. Nope. Thank you so much,
Yeah.
Veronica. That was a fantastic presentation.
Thank
So
you
for
so
those
much.
of you who have joined this presentation, we have exciting presenters like Veronica on a monthly basis. So we will be posting them, as time goes by, what comes up. So thank you for everyone for joining this presentations.